Hi, my name is Sylvia and today I'm going to demonstrate my school trigger. So before I even get my patient, I'm going to set up the room and I'm going to start by cleaning the Bucky. And then I am going to detent my tube. So the SID for all these projections are 40 inches. And then the first image I'm going to start with is my lateral. So I'm going to go ahead and collimate to 10 by 12 crosswise. And now I'm going to go get my patient. Miss Rodriguez? Hello.
Hello,
Can I have your full name and date of birth, please?
I'm Erica Rodriguez, and February 2nd, 1970.
Okay. And is there any possibility of pregnancy?
No.
Okay. And then I see you have earrings. I'm going to need you to remove those.
Okay.
And if you have any hair clips or dentures, I'm going to need you to remove those before the exam.
Okay.
And what brings you in today?
Well, just having some headaches, so they just want to check if there's something, and I had a car accident, so just want to just make sure everything is clear.
Okay. I'm starting with my lateral, so before I begin, I'm going to shield my patient. Okay, and I want my patient's mid-sagittal plane parallel to the Bucky. Face me. And then I'm going to slightly oblique her because I want her face against the Bucky. And I want her intrapupillary line and her IOML perpendicular to the Bucky. And the central ray is going to be 2 inches above her EAM. And I have my IR in crosswise, 10 by 12. My SID is at 40. So the technique I would use for the right lateral is 85 to about 18 to 20 mass, and to put on my right marker to indicate this is my right lateral image. So, Ms. Rodriguez, go ahead and take a deep breath in and hold your breath. Beep! And breathe. So the next projection I'm going to do is my PA axial Caldwell. And I have my tube angled at a 15-degree caudate angle. And my central ray is going to exit at the patient's nasion. And I'm going to position my patient so that her mid-sagittal plane and her OML are perpendicular to the Bucky. And my patient is shielded. I have my left marker on my patient's left side. And my cassette is 10 by 12 lengthwise. And the technique I'm going to use is about 85 to 14 mass. So Miss Rodriguez, go ahead and hold your breath. Beep. And on to the next projection. And again, this was at 40 SID. So the next image we're gonna do is the AP axial Townes method. And I'm gonna start by angling my tube at a 30-degree Caudat angle. I'm at 40 SID. I am going to, the IR is gonna be 10 by 12 lengthwise. And my patient's mid-sagittal plane, close your eyes. My patient's mid-sagittal plane is perpendicular to the IR, and I'm gonna tilt her head. I want my patient's OML perpendicular to the IR. And my central ray is going to be 2.5 inches above the glabella. This is going to move down. My right marker on my patient's right side. My patient is shielded. And I'm going to open my collimation just a little to make sure I get her entire top of her head. Okay. So Ms. Rodriguez, before I give you these breathing instructions, the technique I would use would be the same for my Caldwell. So I would use 85 kV at 14 Mass. Ms. Rodriguez, go ahead and hold your breath. Beep. Okay, so this last projection is going to be the SMV projection, also known as the Scholler method. So I have my tube detented to 40 inches. I have my patient shielded, and I am going to collimate to 10 by 12 lengthwise. I already have my marker ready on my patient's right side. And now I'm going to position my patient. So her mid-sagittal plane is perpendicular to the IR, and now I'm going to need to adjust her head so that her IOML is parallel to the IR. And then bend it more. Okay, and the central ray, if you can see, is going to enter perpendicular to the IOML, and it's going to enter at the mid-sagittal plane of the throat between the angles of the mandible and pass through a point 3/4 anterior to the EAM. Little bit. Bring it down. Collimation. Put my marker on her right side. Okay, Ms. Rodriguez, go ahead and hold your breath. Beep. Now I exposed. Okay, go ahead and lift your head back up, close your eyes. And the technique I would use is 85 kV to about 28 Mass. So here is my lateral projection of the skull. It shows evidence of proper collimation. It shows the entire cranium without rotation or tilt, and it shows the superimposed orbital roofs and greater wings of the sphenoid. over here. The sella turcica is in profile, right there. And it shows superimposed TMJs as well as superimposed mastoid regions and the EAM. The central ray is 2 inches above the EAM, and it shows penetration of parietal regions, and there is no overlap of the cervical spine right here. Here is my PA axial projection, also known as the Caldwell method. The central ray is angled 15 degrees caudad and it exits the nasion. This image shows evidence of proper collimation. It shows the entire cranium without rotation or tilt. It shows equal distances from the lateral borders of the skull to the lateral borders of orbits on both sides. Right here. It shows symmetric petrous ridges right there. And the mid-sagittal plane of the cranium is aligned with the long axis of the collimated field. And you can tell this is a good Caldwell projection because it demonstrates the petrous pyramids line in the lower third of the orbits. Right here. Oops, higher. Right there. And it shows the entire cranial perimeter, showing 3 distinct tables of squamous bone. It also shows penetration of frontal bone with appropriate brightness at lateral borders of the skull. Here is my AP axial projection, also known as the Town method. The central ray is directed through the foramen magnum at a 30-degree caudad angle to the OML. This is a good skull image because it shows the dorsum sella and posterior clinoid process are visible within the foramen magnum. It shows evidence of proper collimation, the entire cranium without rotation or tilt. It shows equal distances from the lateral borders of the skull to the lateral margins of foramen magnum on both sides. It shows symmetric petrous pyramids. The mid-sagittal plane of the cranium is aligned with the long axis of the collimated field, and it also shows penetration of occipital bone with appropriate brightness at the lateral borders. Here is my SMV projection. It's also known as the Schuller method. The central ray enters right about here. It enters between the angles of the mandible and passes through a point 3/4 inches superior to the EAMS. It shows evidence of proper collimation. It shows the entire cranium without tilt. It also shows equal distances from the lateral borders of the skull to the mandibular condyles on both sides. Right there. As well as symmetric petrosa. The IOML is parallel to the IR. This is a good image because it shows the mental protuberance superimposed over the anterior frontal bone. And the mandibular condyles are anterior to the petrosa, and it shows brightness and contrast sufficient to demonstrate cranial base anatomy.